Good morning, everyone. I'm Jill Chadwick, in for Dr. Steve Stites, Chief Medical Officer, but only for a nanosecond, we hope, because he is involved in we're getting magnet recertification. Joining me in studio today is Amanda Cackler, because Dr. Hawkinson's son, Wyatt, has advanced in his soccer play. And the game is happening right now. But not to worry, because we are welcoming our CMOs back. So we have plenty of doctor power this morning. Dr. Larry Botts from Advent Health, Dr. Raghu Adiga from Liberty Hospital, and Dr. Mark Steele with Truman Medical Centers, University Health. So we're so anxious to hear how they are doing with COVID-19 patients since the Delta virus has arrived. But first, Amanda, let's talk about our own numbers.
Sure. So we are currently at 21 total patients in our hospital. I know we have 2 active cases out at Hayes. Here at the main campus, we have 5 in the ICU. 13 of the 21 are active infections. 5 are in the ICU. Unfortunately, 4 of them are on ventilators. We do have 1 ECMO patient, and then the other 8 are recovering. So we have some very sick folks right now. I think the age range of our patients are 25 all the way up to 90, so a very wide range of ages.
Wow, that is something we're going to probably, I'm sure, dive into. And I can't wait to hear what the numbers are with our other doctors that we have online. But first, doctors, I need your help because Dr. Stites is not here, and we have reporter questions this morning that were sent in ahead of time. First question is from Cody Holiak with Channel 9 News. He says, I'm out on assignment this morning and unable to virtually attend, but he had this question for you. Larger counties in states like California are starting to ask people to mask up again in indoor public spaces, even if they have been vaccinated. The main concern seems to be the Delta variant. Do you realistically see Kansas and Missouri asking people to re-mask? And I think I will start with Dr. Botts, who you're retiring, I hear.
Yes, that is true. So you're picking on me for that reason, I suspect.
I am, totally.
Gave me the tough question. So we want to talk about realistically. I think that would be a really difficult thing to do, to reinstate a mask mandate. I think that we know that we've had a little bump in our cases across. We have the Delta variant. We also know that the vaccinated population still is well protected against the Delta, and so I think at least for vaccinated people, for sure, I don't think that that's going to become something that we're going to mandate that we start wearing masks indoors. At least not in Kansas. I don't see that happening. It's still a good recommendation, certainly if you are not vaccinated, to wear a mask in those situations to protect yourself and protect others. But I don't see us going back to a mandate.
Well, let's go to the Missouri side. I'll pick on Dr. Steele first. What do you think about a mask mandate, reinstating it?
Yeah, good morning, everyone. Of course, that's going to ultimately would be up to our public health officials and colleagues, but I agree with Larry that I think that's a pretty steep hill to climb, and I think the focus really just needs to continue to be on getting folks vaccinated, because there's no question that these vaccines are just incredibly effective and really protect people and protect even against the Delta variant. So I concur.
Dr. Fauci this morning, I heard on the news, was saying that there's going to be a division between the haves and the have-nots, those who have a vaccine and those who have not. Dr. Adiga, would you, as an infectious disease physician, be recommending that people be on the safe side if you're not vaccinated and keep your mask on?
Of course. I mean, that's been the recommendation all along. I think people did not understand it very well. CDC never said don't wear masks if you are not vaccinated. The question has been trying to figure out who's vaccinated and who's not. And so in the community, everybody went without the mask. So that's been the biggest issue. And I don't think we're going to solve that other than keeping on telling people to get vaccinated, as my colleagues recommended. I think vaccination is the best answer for all of these. The more number of people get vaccinated. We know very well that mRNA vaccines are extremely effective, even against the Delta virus. So the more people get vaccinated, the better.
Amanda, any thoughts on masking from you?
I think they've really hit the high points in regards to who should continue to mask, and that has always been, if you're unvaccinated, you really do need to protect yourself and other unvaccinated folks. And I know we also have the vulnerable population of those under the age of 12 who can't be vaccinated yet. So there still is a need for masking if you haven't been vaccinated. And I think the key point here is that we will continue, unfortunately, see variants as folks are unvaccinated. So there's that risk of mutation in populations who don't have the vaccine. And so it doesn't also, I mean, it protects you, but it also protects us from the potential for future variants if more people get vaccinated.
Well, good news, everyone. Dr. Stites is in the building, and he's in the studio. So I'm going to ask Cody's second question so that he and I can switch places magically. And I'm going to go around the horn again, starting with Dr. Botts. What's the challenge then moving forward with this emerging threat, Dr. Botts?
Well, I think our challenge is still to get people vaccinated. I mean, and it is a challenge. We've gotten to a point where most people who want that vaccine have been able to get it. It's readily available. We have plenty of supply. And so we need to continue to encourage people, do what we can to get people vaccinated, because that's absolutely our best defense against COVID in general. It just is continuing to get that population that's not vaccinated in that vaccinated category.
And this is a Channel 9 question, Dr. Stites, from Cody on what is the emerging threat. Dr. Botts' answer, but your other two colleagues and, of course, yourself, have a go.
All right, Mark Steele, what do you think? Delta.
Yeah,
Not the airline.
Obviously
Not the
the issue
airline.
with Delta is that it's proven to be more transmissible and also more likely to land you in the hospital. We're not sure yet. I don't think about whether it's going to be potentially more deadly. And so, and the people who are at risk are obviously those who are unvaccinated. And so that group of individuals need to be very careful about masking and social distancing. And obviously, we strongly encourage that they get vaccinated as soon as possible. And I think we've already heard that, the risk, obviously, for everyone in general is that if we continue to have people where the virus can infect, then we're at risk for developing additional mutations. And we hope we don't get one that then renders the current vaccine somewhat ineffective.
Thank you. Raghu Adiga.
Yeah, I agree with my colleagues. I think the biggest concern going forward is, if we continue to let this go on, further mutations in the virus, and whether it will mutate further into, vaccine resistance more and more, that's going to be an issue. And of course, already this has become, the disease of the haves and have-nots, and it's going to exacerbate with the people who are not vaccinated. And even among the ones vaccinated, I worry if they are immunocompromised and elderly as the fall season comes through. We've already seen a few of our patients, transplant patients and cancer patients having breakthrough infections. So I think biggest issue is vaccination, being able to get the numbers up. And of course, we do have issues with the healthcare staffing, and already we put a lot of strain on them, and that's going to continue, unfortunately. That's my second concern.
I think especially as you've mentioned, a concern to the chronically ill and to the transplanted patients, et cetera. I had a patient I talked to yesterday whose husband had just contracted coronavirus and was ill. She's got a chronic disease, just cystic fibrosis, and now all of a sudden, she's concerned because they haven't been vaccinated. She's, well, how soon can I go get vaccinated? My answer, well, just go get vaccinated right now, and we'll worry about the rest later. But I think that the issue is if you wait until you're sick, you've waited too long. And the Delta virus doesn't really care if you think the vaccine is real or not, or that the virus is real or not. It doesn't care what state you live in. It doesn't care what your color is. It doesn't care what your political affiliation is. Delta virus is looking for a home. and that's going to find your home and those who are unvaccinated. And I think yesterday on the Chief Medical Officer call, we also noted that first, we have a much younger population who's hospitalized right now with COVID-19. And second, these patients are still really sick. Larry, I think that you know that they're still sick right there at Advent.
Yeah, absolutely. We've had an uptick in our numbers, and we have a wide range of ages. We still have some older people who are being admitted as well, but it's a younger population in general, and they are indeed ill. We've not had. I guess the good news is we've not had one vaccinated patient that has been actually admitted to the hospital. So we've been. That shows you that vaccine is incredibly effective. Now, it's not 100%, but it certainly protects you, even if you do get COVID, from getting to the point where you're going to be in the hospital and on a ventilator. But yes, we have very sick people still.
And Amanda, we haven't relaxed our masking guidelines because we're always concerned about these things. And we're seeing Los Angeles County going back to masking indoors, as has Israel, and masking in large outdoor gatherings. And the reason is fear of Delta virus.
That's right, and we sort of touched on this a little bit as far as do we think mandates will come back. We don't think that is going to be the case, but of course we'd have to leave that to the public health officials. But we do know that the masks have been protective throughout the duration of the pandemic. We know the vaccine is extremely protective against it, but if you have any concern about being in large group gatherings, not knowing the vaccine status of those that you're going to be around, there's nothing wrong with putting a mask on because we know it will protect you.
Well, we know that the rules of infection control travel with you.
That's right,
wherever you go, and they still keep you safe. Look at all the chief medical officers with a big smile on their face. They're yep, that's exactly right.
Heidi with Fox 4 has a question, too. She's worried about going into the, I don't know that she's worried about. She said people are concerned about the 4th of July gatherings with COVID starting to spike again. How soon do you think that we would see impact from people gathering over the 4th of July if they're not masking and they're spreading COVID?
Oh, you're right. We know, Dr. Adiga, that this takes a while. We see the ripple effect, but sometimes within 7 to 10 days we'll start to see it. It really takes up to 6 weeks to see all the impact, I think.
Yeah, I agree. I think most of the infections will take 1 to 2 weeks, but hospitalizations take anywhere from 3 to 4 weeks, and deaths usually 6 to 8 weeks from any outbreak. That's how the pattern has been all along. Yes, it is a concern, though, July 4th. But mostly those gatherings happen to be outside rather than indoors. That's a plus. But again, not always. It is a concern.
Yes, it is.
All right, that's all the reporter questions we have, but we're already getting some community ones. However, I haven't had a chance to quiz the docs yet.
I'm going to quiz the docs, Senate. Have you talked about the numbers in each hospital?
Not really, just
okay, here we
briefly
go.
touched on it.
Larry Botts, talk about your numbers.
So we currently have 16 people in the hospital that are COVID positive. We have 2 in the ventilator, 2 in the ICU. As of this morning, we don't have any on ventilators. We did have one, but fortunately we were able to get that patient off the ventilator. So that's a pretty big increase from what we've been having. 2 weeks, 3 weeks ago, we were averaging single digits as low as 2. And so there has been a definite increase within the last 7 days here, and we're a little concerned about that.
I think that's for sure. Mark Steele, how about over at Truman? How are you doing?
Yeah, we this morning we have a total of 17 patients in the hospital. 14 of those have active infections, and fortunately we only have 1 in the ICU, although that person is on a ventilator. We pretty much have been hanging out in the low to mid-teens here for a while. We had gotten as low as 5 about a month ago, so we've definitely seen a little bit of an uptick. And then I would just echo what Larry talked about, in that we have not had a single patient who's been admitted who is fully vaccinated. So once again, just to highlight how incredibly effective the vaccines are at keeping people out of the hospital. And we also are seeing a younger age group. So we've got folks in their 30s and 40s, but some older individuals as well, as Larry highlighted.
And our sickest patient is 25 on ECMO. 25 on ECMO. Can I say that again? And otherwise healthy.
Otherwise healthy, not vaccinated, coming in extremely ill and just, I mean, in a very, very critical state.
Remind people what ECMO is, too.
So ECMO says, okay, where your lungs don't work, think of it as dialysis for your lungs, is probably the best way to explain it. You know, dialysis helps remove the bad things and give you back cleaner bloods because of what your kidneys would normally do. ECMO helps take out carbon dioxide, the waste product of breathing, and put back in oxygen so we don't put so much pressure in your lungs, we end up tearing up the lungs with a ventilator. So ECMO is for the sickest of the sick, and for people you think otherwise you have to be halfway healthy to get it, meaning that you can't have a lot of other comorbid conditions. And so oftentimes it is a younger population, but to go on ECMO means your lungs have to be really failing, and for that to be true and to be 25 and previously healthy, that's just bad news. But that's what COVID-19 does, and those who think that they're immune from it, think again. Raghu, how are things up in Liberty?
Yeah, at Liberty, you know, we've seen an increase in COVID volume for the past month or so from mostly coming from up north here. Currently, we have 14 in the hospital, and 2 of them are in ICU on the ventilator. And again, the age group varies. We do have some of our young patients as well. I think one of them is 36. We do have a couple of patients who are fully vaccinated, actually hospitalized. One is a kidney transplant patient, and another one is very elderly, immunocompromised. So that's who we usually see, but they are not terribly ill. They're on the medical floors, not in ICU. That's the benefit. But the rest of them are all unvaccinated.
Yeah, I think, and the ones we've seen that have been hospitalized and vaccinated, Amanda, there are people who have a lot of underlying illness or have had transplants.
Yes, that's correct. We do currently have 4 of our active infections that are fully vaccinated, but they also are have extensive medical histories that, you know, when they have come in, they have worsening pulmonary symptoms or COVID symptoms, but they also have underlying pulmonary conditions. So it's hard to know, is this being exacerbated? Is it just the COVID, or is it really kind of their chronic condition that's bringing them into the organization? And then we also have several that are immunocompromised, cancer patients, that kind
Yeah,
of thing.
so I think the story's still the same. You know, look, if you're otherwise healthy and you've been vaccinated, you're probably going to do just fine. If you got a lot of chronic underlying illnesses and you're vaccinated, you still have to think you could be susceptible to COVID. We know that that's true in the transplant world. For example, the number of the patients who have a good antibody response after one vaccination with Moderna and Pfizer who are otherwise healthy, it's about 90% or so. Well, Raghu, you can correct me here in a moment. But if you've had a transplant, it's about 30%. And if you've had just 2 doses, it's about 68%. Where the rest of it, the rest of us, it's crazy good. So if you've got chronic underlying disease, or you're in chemotherapy, or you have a transplant and you're on immunosuppressive drugs from transplant, or for bad rheumatoid arthritic diseases or lupus or what have you, you have to still think you're immunocompromised. And by gosh, you should still wear a mask wherever you go. I'm sorry, you should just wear a mask to stay safe, because you just don't know how that vaccine is going to behave in that world. But for the overwhelming majority of Americans, and for those living worldwide, vaccination is the get out of jail card. It is the way to go back toward a more normal life. But if you haven't been vaccinated, remember, the CDC doesn't say that you're safe. The CDC says you should still be wearing a mask. Now, when I go to the grocery store, it means everybody's wearing nobody wants to wear a mask anymore, so I'm assuming everybody's vaccinated, and I know that's not true. And the problem is that you still spread the disease. And the Delta virus is a lesson for us. And we're learning it the hard way, especially if you're down around the Springfield-Branson area. You're learning it the hard way. If you're not vaccinated, you're not safe. Team, other thoughts about that? I see some heads shaking, Raghu.
Yeah, I mean, absolutely. We know that, you know, when the initial variants came, we knew that they were more transmissible, and now we have Delta, which is you know, anywhere from 3 to 4 times more infectious compared to the original strain that we had. So it takes a lot less effort to spread it around. No question about that.
Larry?
Yeah, I agree. I think there is no better plan than to get vaccinated. I mean, and then and I agree with you, Steve. Certainly, those people who are immunocompromised and have those chronic conditions, they still need to follow those infection prevention pillars that we talk about all the time to protect themselves.
Mark Steele.
Yeah, really nothing to add. I mean, I absolutely agree with my colleagues in that, it's all about the vaccinations, and obviously those high-risk individuals, even when vaccinated, need to be particularly careful and probably err on the side of masking and distancing.
Yeah.
I also want to add about the second dose, Steve, mainly because we do know with the Delta that just one dose is only about 30% protective as compared to getting the second dose, which gets it all the way close to 90%, 80 to 90%. So if there are people out there who've gotten only one shot and decided not to get the second one, I think they should go get it now.
I totally agree. And remember, live long and prosper, which means, people, you're only safe if you've been vaccinated, because if you haven't been vaccinated, you're not safe. And the Delta variant is the most dangerous of the variants we've seen because it transmits at an even easier than the original coronavirus or than any of the other variants. So beware of the Delta. Jill,
I have
please.
a comment to add to that. First, I was laughing because you say live long and prosper, and they immediately raise their arms up
Yes,
to
they do.
show.
Well, they're all Trekkies.
It's amazing. But there have been several people who have said, well, I had coronavirus, in the winter time or earlier in the year, so I have natural immunity. I don't need to get the vaccine. And I think this is an important point, that the vaccines are way more protective against the variants than the natural immunity you may have had earlier on in this.
Yeah, that's
pandemic.
a great point, Amanda. Thank you, because I totally agree. The vaccination does keep you safe. COVID, well, that's just a danger.
Community questions?
Please.
All right. Sydney wants to know if the doctors, our panel, thinks that we're in the third wave.
All right. Well, I'm going to just take a flying leap and say Springfield is clearly in the third wave. The United States is in a third wave because we're starting to see an uptick. I think it's very early, and hopefully it won't be like the others unless you go to the areas of the country that haven't been vaccinated, which is southwestern Missouri, which is why Springfield's in trouble. Mark Steele, what are your thoughts?
Yeah, no, I mean, absolutely. I think we are in a third wave, and clearly it's impacting those communities that have lower vaccination rates. We know that the rural areas have lower rates, and in southwest Missouri is a clear example of that. And not only Springfield, Joplin has seen extraordinarily high case rates as well, and increased in hospitalizations.
Larry, third wave?
Yes, I do believe we're probably at the beginnings of a third wave. I'm optimistic that it's going to not be like the other ones because of our vaccination rate. We could do a lot better, but it's going to protect us, I think, from having the same kind of infection rate that we had with the two earlier ones. But I think we are certainly, for those unvaccinated, we're in the third wave.
Dr. Adiga.
Yeah, I think it all depends on what you call a wave. The first one and the second one, if you look at the whole country and the large numbers, yes, it is a wave. But if you look at what's happening now, it's a bunch of ripples everywhere. It's all in, individual communities in small areas of, less vaccination. So you start seeing the number. Overall, for the country, the number may not go up a whole lot, but in region by region, you're going to see a high number. So it's a third wave in multiple different areas.
Yeah, it's kind of like you know how you're kind of staring at the ocean and the waves come in at you, and sometimes they start to break up. We can hope vaccination breaks this wave up, but you can see it out there kind of coming at you from the distance. And to your point, it's coming at you unevenly because some communities are much more vulnerable than other communities. But I think healthcare systems are more vulnerable in a different way right now, Amanda. So you and I want to talk with you a little bit about this. Yeah, here we go. This has been a long 18-month ride. Right? We're a little over a year and a half now. Staffing, it's been hard because people are sick. But the other thing is folks are sick back in the hospitals again. Our case mix index, which is a measure of how acute you are, has never been higher. And yet we don't have as much COVID as we had 6 months ago. We have more than we were for a while, but we don't have nearly what we had 6 months ago. But the hospitals are full, and I think we're going to check with our CMOs. I think everybody's full. What that tells us is we don't have a lot of capacity if a big third wave emerges, whereas before, when there was a lot of mask wearing and people were being kind of staying inside, we weren't sharing all the other common illnesses we get, and as a result, we weren't full. But now we're like backed up full. So if a big wave starts, I think we're more vulnerable in that.
I would agree with you completely. And we, like you said, we don't have a lot of capacity to add 10, 15, 20 additional COVID illnesses on top of what we're dealing with. So when you think about our average daily census being between 700 and 800, where only about 20 of them are COVID. If we added another 20, that we won't have
There's no
room.
beds.
Yeah.
Yeah, and I think that the sheltering actually had another interesting effect. People just weren't getting sick; they weren't coming to the hospital. But that's not true now. So, Mark, how's it over at Truman right now?
Yeah, we're full here as well. I mean, we're not bursting at the seams, fortunately, but obviously, if we continue to see an uptick and typically as we get into the summer months, we pick up. And so certainly we would have concerns if the numbers were to continue to climb.
Raghu, how about up in Liberty?
Yeah, this morning we are at 98% of bed capacity. That doesn't necessarily mean we can't make additional room and find additional staffing to take care of them, but it is pretty tight.
And Larry, Advent, Shawnee Mission.
So, we're in the same situation. We are full. We have some bed capacity if we had a little more staff to be able to do it. That's been the biggest, our biggest challenge by far is keeping up. But for the staff that we have, we are pretty full, and so we couldn't take a lot more, a big surge of patients that would be difficult for us.
Yeah, so I think, man, if we've got to keep each other safe. We've got to keep our community safe. We've got to keep the Chiefs, Tigers, Sporting, KU, Mizzou, K-State, everybody else, keep our high schools, keep us all safe. And there's no question that vaccines the way to do that. And there's no question that vaccines, Jill, are incredibly safe.
Sarah says, Dr. Botts, you're going to be missed. She wonders if COVID-19 is going to impact your retirement and where COVID-19 ranks in your career as a physician in terms of challenges.
Wow, that's a tough one. Well, I told Dr. Steele and Dr. Adiga earlier that I've been telling people I was going to retire in 2 years for about the last 4 years, and I will say that I think it has been an interesting 18 months. I am glad that I stayed, actually. In the middle of that, I probably would not have said that, but I think looking back on it, I'm glad I was able to be able to be here for that. It's probably been the most impactful thing that's happened in my career from a standpoint of just looking at it overall and what's happened. And so I'm ready to go, but I'm glad I was here.
So can I stay personal moment? For those of you who don't know Larry is one of the most modest and humble individuals you can meet. He has been an outstanding pulmonary critical care doctor in this community for a long time. His patients have had outstanding care. He's been a great doc over at Shawnee Mission, which is a fine hospital, and he has been their chief medical officer. Larry Botts will be missed in our community for his steady hand, his intelligence, his compassion, his ability to do a great job of taking care of patients. And anytime Larry sent a patient over here and I would see them, I'd be like, yeah, well, what am I going to add to this? Really? Come on, people. So I think he's a great doc. Larry, we will miss you. Congratulations on the end of an outstanding career and for being one of the steadying hands throughout this pandemic. Thank you for the great work you've done. It's outstanding. So
I think it's always hard on the patient.
Thanks, Steve. I mean, I'd like to thank, and Dr. Adiga, Dr. Steele, Dr. Stites, all of all the CMOs in the city. It's been a great collaboration and cooperation that we have had with amongst our hospital systems, and I think I got to thank all of you for that. It has helped in multiple ways for us to handle this pandemic. So, thank you.
Is that a normal venue that you were doing before the pandemic?
No, this started because of the pandemic.
Right? Like, this is actually a very good
It's a
good
cool thing. We're going to keep doing it. You know, it's funny because we had our CMO call yesterday. We said at the end, we're like, wow. Who knew we could all work well together? Right? Who knew that HCA, Shawnee Mission, Liberty, Truman, St. Luke's, KU, Olathe, all these great hospitals could work together. Kansas City is actually very blessed to have a great healthcare community. And we have a lot of great hospitals, a lot of great systems, a lot of great CMOs, a lot of great people. So we're very blessed as a community.
Louise wants to know if any of the doctors on the panel know how many people in southern Missouri are vaccinated.
Oh gosh, it goes county to county. I can find the stats here in a minute, but I think Raghu, you're the ID doctor. Do you know that number off the top of your head, or Mark?
I think the counties near Branson was about 20% to my recollection, as low as 20%. There have been some that are closer to 30%. This is fully vaccinated I'm talking about. It's been very low.
And Mark, do you know, I know you guys are near Missouri Hospital primarily.
Yeah, no, I mean, I think Raghu's right. I mean, it varies by county, but some are down in the 20s and certainly no better than the low 30s. And so, I mean, but clearly there's a relationship between the spread that we're seeing and what that percentage is.
Yeah, if you'll give me 1 second, I'll find the exact number because I thought it was actually even lower than that, but I can get to that. So.
Okay, shall I ask another question?
Please.
All right. Janessa wants to know, with the metro area seeing an uptick in the Delta variant, what is the doctor's opinions about schools planning and reopening, and wondering if that will then lead to another spike?
All right, guys, what do you think? Reopenings, et cetera. Numbers went down during schools getting more open last year. The problem is the Delta virus is so darn transmissible, 20% more than the Alpha virus, which is another 30 or 40% more than the original virus. So, I mean, this is an interesting danger zone. I think the question is all going to come down to how well people are vaccinated. What do you think, Raghu?
Oh, I totally agree. Its concern is not that these children who are going back to the school are going to be infected and suffering from the Delta virus. The concern is them bringing it home to the unvaccinated adults at home. So if you can get all the adults vaccinated, those who are eligible for vaccines, get them vaccinated, I think it should be reasonably okay.
What do you think, Mark?
Yeah, no, I agree with Raghu. I don't, and I think it also, I mean, I'm assuming that the schools, or I guess one question may be, are the schools going to continue to require masking for the students? I mean, obviously that's a big protective measure, and so, but getting the adults vaccinated, and obviously the kids who are eligible for the vaccine, trying to get them vaccinated as well.
Yeah, I think that makes sense. Larry?
Yeah, not much to add. I agree with my colleagues. I think the vaccination of the adults, and then hopefully, that's a fairly large population of kids that we're able to vaccinate now, starting with the age 12. So, encouraging them to encouraging their parents and all of them to get vaccinated as well will help.
Yeah, I think that's right.
Kathy wants to know, if you are vaccinated and you get COVID, do you get the long haul problems?
Guys, what do you think? How about long haul syndrome, Raghu?
I don't think we have a perfect answer to that yet, but we do know that people who are vaccinated who get breakthrough infections are not that ill. And we do see that people who have long haul syndromes tend to be actually more ill than the others. So you can extrapolate and say that, okay, well, I didn't get very ill with my breakthrough infection, and chances of having long haul syndrome would be less. That's my guess.
And just to interrupt for a second, I found some counties in southern Missouri that are in the 15 to 20% range for full vaccination. So, Yeah, it's really low in some of those counties, which is why the Delta virus is ripping through them. It's why Springfield's having so much trouble. And part of the reason they are also having so much trouble, just to get back to that question about Springfield, is that they too had a higher census in their hospitals, and now they're getting 80 or 100 COVID patients, and they are displacing it, which is why we're seeing transfers into Kansas City from Springfield with COVID-19. Sorry about that.
He had a great answer. I don't know that there's anything that we can add to it.
Okay.
Okay, Donna says, a friend in the KC area got together with a family over Father's Day. All adults were vaccinated. There were kids there too. Of the 11 adults, 5 have since tested positive for COVID. They don't know if it is the Delta variant. They have all gotten different information about staying at home, having to social distance. Some have been told they aren't likely to be contagious. Can you provide some clarity? And she also wants to know, why aren't we testing to find out if it is the Delta variant?
Yeah, so I'm going to take the easy part of that question. The reason we're not testing is because it's hard, it takes a lot of information, it takes a long time, and it's very expensive. So we do test. We do send off cases that are unusual, and then there's some random testing that both states do. And Kansas is actually pretty good about doing testing to see how much the Delta virus has come up, which is why we know that it's the most predominant form in Kansas now. But, man, is there confusion around this? I'm going to first turn to Amanda. Amanda, I think there is confusion around what do we tell people who are vaccinated about staying at home? What do we tell our employees if they've been vaccinated and they become positive?
Yeah, and I'm going to answer that question. We get this question quite a bit as to which cases are we testing for the variant. And at current, we are only testing those that are considered a breakthrough infection. So if they've been fully vaccinated, we have a positive test. We are sending those ones for genomic sequencing. However, we don't always know what the results of that are. It doesn't come back to our electronic medical record that goes to the state for epidemiological purposes. But as Dr. Norman has stated before, with the testing of the wastewater, that's a much better way or more robust way of really evaluating what variants exist in the community. We're talking now with our director of microbiology about should we establish a more random sample collection of our specimens that are testing positive for that genomic sequencing. But unfortunately, it doesn't change the way we treat folks who are COVID positive. The treatment's going to be the same. The protection is going to be the same regardless of the variant that exists. What do we tell folks who have been fully vaccinated who are testing positive for coronavirus now? So typically, or according to the CDC, they aren't even really recommending the testing unless you're symptomatic. So this could be the difference within this particular scenario are of those adults that were impacted, were some symptomatic and some not symptomatic. If you're not symptomatic, do you need to quarantine or isolate or stay socially distanced? Right now, they're really limiting those strategies if you are displaying symptoms. That's what we tell our employees. If you have someone in your household who's tested positive, it's okay to come to work unless you have symptoms, in which case we would have you go get tested. And again, we're in the healthcare environment, we're still masking, and I still mask really in any public situation where I can't control those that are around me. I don't know what those interactions are going to be, just because I know there is a large volume of folks out there who are unvaccinated.
And do we distinguish for those who are vaccinated or unvaccinated when you have those conversations with our employees?
Say that again.
Do you distinguish how you respond if they're vaccinated?
If you're unvaccinated and you have a household member who is positive, then we will have you get tested. So the vaccination does keep you from having to do the isolation.
Okay, so I think that feels right to me, but I don't know 100% because, gosh, you could still be spreading the Delta virus. I don't know. Raghu, infectious disease doc, what do you think?
Yeah, here is how I look at it. If you test positive, you have to do the isolation. It doesn't matter whether you're vaccinated or not. If you test positive, you need to stay in the isolation for 10 days. Now, the question is about just exposure, not testing positive. You're exposed to someone with COVID. If you're vaccinated, it's okay. You don't need to be in quarantine. Quarantine is for the asymptomatic people. So you don't need to be in quarantine if you're vaccinated and you were exposed. However, if you're not vaccinated, we still do the quarantine for 10 days.
Larry, what are you doing at China Mission?
That, I think, pretty much explains what we're doing. I mean, we're doing the same thing as Dr. Adiga mentioned. I think those that are vaccinated, they don't have to quarantine for exposure. Obviously, if test positive, we're having everybody quarantine. It's a difficult situation. And again, we also only test or only recommend testing people who, particularly the vaccinated patient who's symptomatic. The exposure at that point in time, you can come to work unless you develop symptoms. So we're not quarantining.
Yeah, and I apologize. I know Advent shunning mission. I'm incorrigible. Jill corrected me. So old habits die hard, Larry.
I'm more worried about Morgan, my counterpart.
I know. She's going to call you. She goes, what is Stites
Morgan's
doing?
sitting right here, and she'll let you know. Yeah, I do the same thing, Steve. I mean, I've worked here for too many years. Shawnee Mission is still Shawnee Mission, not Advent.
I know. I'm getting better though. So, Morgan, I'm sorry. Mark Steele.
Yeah, nothing to add. I mean, what Larry and Raghu have described is what we're doing here at Truman.
Yeah, I mean, and I think it's the right thing, guys. At some level, you just, even though the Delta virus, or the virus in general, and Delta in particular, if you've been vaccinated, there's really good data that your ability to transmit drops. It does not go to zero. And what we need to do is stop the transmission of especially this Delta mutant.
Okay, so we got could be maybe kind of rapid round here. Sue wants to know, when do vaccinated people need to get revaccinated?
Okay. Mark, what do you think? Revaccination?
Well, I mean, I don't think we know that with certainty yet, and it's interesting that there's some recent information that came out that suggests that the vaccines may actually last a very long time, if not potentially a lifetime. And so I think at least the messenger RNA vaccines, I should be specific about that. So it's going to be interesting to see how this pans out.
Yeah, I think it's going to come down to the variants, and if you need to have a booster for a variant. For a long time, I thought I would be getting boosters at a year, but man, I'm with you. The recent data suggests that vaccination success and immunization could last a lot longer, and the variants are really going to dictate that, and I think that's going to really drive the booster.
Diana wants to know, Amanda, would you say again, of today's numbers, how many were fully vaccinated?
So we have 13 active, we have 8 recovering. Of the 13 active, 4 were fully vaccinated.
And that should concern all of us, because are those breakthrough infections, are they people who never really had a good immune response from the vaccine? Because each of the people, we're not getting young people who are getting vaccinated, or anybody without serious illness who've been vaccinated coming into the hospital. What we're getting is some of our chronic, most sick patients who come in. And we've always known, in that patient population, what's your success rate? And that's where we turn to the transplant literature, because transplants did a pretty good job of seeing what their success rate is after vaccination. And what we're seeing in the transplant world is that after 1 shot, you have about a 30%, and after 2 shots, it's about, it's like in the teens, and then it's about 35% after your second shot, and the third shot gives you 68%. But there's no recommendation for a third shot yet, although I think it's coming in the transplant world. And so what it means is that if you are like a transplant patient, which is people whose immune systems have been reduced by their chronic disease, I think you may be more vulnerable, because that's the pattern we're seeing. By the way, that's a pattern that's emerging throughout the United States.
Okay, Ali wants to know, does Delta make young children more sick? And Sarah wants to know, are there different symptoms from the Delta variant?
What do you think, Raghu? How different is Delta in those two areas?
Yeah, I don't think the young children are more sick with Delta than others, but the subtle changes in the symptom at the initial presentation are there with the Delta. For some reason, Delta seems to act more like the common coronaviruses, with more of runny nose, more headache, more common than the cough and shortness of breath or loss of taste and smell sensation that we used to see with others. It's more skewed towards common cold. So people kind of neglect that, thinking that it's a cold. So that's been one of the reasons as well why the spread is a little bit more common. That's about the subtle difference. We don't see a whole lot of difference once they get sick enough and get to the hospital.
Okay, we have a lot of questions. I know we're running out of time, so how about 2 more?
Okay.
Sandy, she's wanting to know what you think about hospital nurses who have not yet gotten vaccinated, And at your hospitals, will you be requiring it?
Oh, this is a great question. Larry, I'm going to stick you with that hard one.
There you go.
there you go.
You're retiring
You can see
anyway.
whatever you want. You used to walk out the door.
Yeah, ended well. Well, I will tell you that I'm fairly optimistic about our numbers from a standpoint of percentages at Advent Health Shawnee Mission, in that we have about 80% of our associates that are now fully vaccinated. So that's a really good, I mean, looking at the population in general, at least from the healthcare workers standpoint, they're taking that seriously. I'm not sure. There are lots of individual reasons for people who don't get the vaccine. I think we're trying to deal with those on a one-on-one basis as best we can. Advent Health will probably at some point in time mandate this as a vaccination, as a condition for employment. With some exceptions, I suspect, but we probably won't do that until it's fully approved by the FDA. But those discussions are taking place, and I think it's probably the right thing to do. We do the same thing. We mandate that with the flu. I think there's no reason that we should not mandate it with COVID once it's fully FDA approved.
Amanda, where are we percentage-wise of our folks? Is it around 70%?
I would say it's in between 70 and
75.
80%. Mm-hmm.
Yep. And I think we're going to be in the same boat. I think, Larry mentioned most hospitals around the country are saying, and most communities are saying, that the hospitals in those communities are moving toward more of a mandatory vaccination once it's been FDA approved. And I suspect we'll be there. I think most people will move that direction. And I think that's likely the right thing to do because it's a bigger health crisis than influenza, and we require influenza vaccination. We've given over 2 to 3 billion doses of vaccine across the world. This is one of the safest things you can do. It's far safer than driving your car. It's far safer than chemotherapy. It's far safer than any other drug you're going to take. And I think the proof is in the pudding, folks, and the pudding clearly shows us after billions of doses of vaccination that it is clearly safe.
We have such a great panel. I wish we could just keep going because we have great questions. But Sarah's going to get the last one today. And she writes, should we be concerned about the variant that is ravaging Brazil? Apparently, especially with Brazilian children.
What do you think, Raghu Adiga? I'm so glad we have an infectious disease doctor on that right now.
Yeah. Well, the Brazilian variant is in U.S., but for some reason, Delta seems to be a lot more infectious and spreading here. And the problem with Brazil is that we don't actually know a whole lot from Brazil because they have not been able to do the variant testing a whole lot. So we don't actually know what's causing most of their outbreaks right now. So time will tell.
All right, so coming up tomorrow, we went to the Kauffman Foundation, the AARP, the CDC, Mercedes-Benz, and the Obama White House have in common. I tell you, that's a hard question. I was lost when they went through the AARP, because, of course, I'm not yet a member of the AARP like Larry is. Our guest tomorrow is these are the
Not a member of the AARP.
No, but Larry is okay. Honestly, I am too. So there. Okay, these are but a few of the big names who have benefited from Dr. Stephanie Evergreen's ability to make complicated data more simple to understand. This has never perhaps been more important than during this pandemic. She's a self-proclaimed data nerd. We love data nerds here, and a lot of fun. Join us tomorrow. We'll have a great time, and we'll have a great program. I want to say a special shout-out to the panel, to Amanda, always sitting in, to Hawkeye, who's not here today. He's always here. He's like a fixture, so I guess that kid having a soccer game, that's
Priority,
a big
yeah.
deal. Gotta
8 a.m.
So let's go around the final thoughts, and I'm going to end with Larry, because Larry's going to be walking out the door pretty soon. So we're going to go in reverse order. Amanda, final thoughts.
Yeah, I think we're seeing a lot of questions coming from the community in regards to the variant and should we be concerned, and I think we are concerned, but I think the answer is go and get your vaccine and protect the communities that you live in.
Mark Steele, final thoughts today.
Just that, I would encourage everyone who maybe knows somebody who's not vaccinated to to encourage them to get vaccinated. I mean, I think we all have to, or we know people that we may be sort of trusted messengers for those individuals. And so I think, we're down to a point where it's sort of one-on-one. We've got to meet people and where they're at and try to encourage them and explain all the reasons why vaccination is so important. And my other thought is I just wanted to congratulate Larry on his retirement and wish him the very best. It's been great to get to know you, and certainly it's been a challenging time, but one of the real pleasures has been getting to know all the CMOs here locally a lot better. So congratulations, Larry.
A lot of fun. Raghu?
Yeah, I don't have a whole lot else to add other than, again, vaccinations. And I'm going to yield the rest of my time to Larry. And congratulations, Larry.
Well, thank you all. And I will just, again, I think give kudos to all of the hospital systems in Kansas City as we have really worked together through this pandemic. A special thanks to Dr. Stites and KU. You've done an outstanding job of coordinating that. And I want to give a little kudos to the media. I think the media has been very good at reporting what's really important and not necessarily sensationalizing things. It's sensational enough, I guess, as it stands, but they've done an excellent job of reporting throughout this pandemic as well. So thanks to the media.
Dr. Botch, you will be
I will miss you all.
as he's sitting in his sunny house and wherever that's going to be. No, Dr. Botch, you will be missed. And I think there's a story here of having a person in healthcare who's been dedicated to the lives of their patients, to the community, to their hospital, and to their team, and what that means to all of us. And Larry, you've really meant a lot. And I think it's those voices that we have to listen to and trust now and forever around these kind of crises. And I want to thank Larry, especially pointing out the success of the media in Kansas City for helping tell a story of truth and not a story of far right or far left dogma, and not being part of the made-up news network, the MUNs. It's been really good. And I think it's people like Larry who help bring us home back to truth and honesty all the time. And it's that keeps you safe. Remember, the internet, it doesn't really keep you safe. It's people like Larry Botts and the folks on this phone and people like Amanda Gartner and teams around us. They work hard every day to keep you safe. And you see, that's what we're here to do. We're here to keep you safe. Now, tomorrow, the day after that, whether it's the coronavirus or it's the next big thing, we're going to try and keep you safe. What we need you to do is help us keep you safe. There's one way to do that. Remember that the rules of infection control are with you wherever you go, and they do keep you safe. And vaccination is safe. And vaccination helps you live long and prosper, which is what we want all of us to be like. We'll see you tomorrow.